Hello, my name is Carolina Cordilha, and I am here to talk about my paper that was published by the Review of Social Economy, entitled Public Health Systems in the Age of Financialization, Lessons from the French Case. So first, what did I do? In this paper, I looked at the financing strategies of the French public health system over the past 3 decades. And this means not only how much the system has been raising revenues, but also from whom and at what costs and conditions. And I did that seeking to investigate to what extent the system might be replacing traditional forms of public funding by strategies that raise money in the private financial sector, notably banks, investment funds, domestic and foreign investors, and so on. I studied three key dimensions of the financing of the system. First, long-term financing, meaning how the system has been raising funds to refinance and manage debt. Short-term financing, meaning strategies to raise short-term revenues so we can pay reimbursements, pay for services when it doesn't have available cash. And also infrastructure financing, basically how it is funding the construction and the renewal of public hospitals. So what I did was to investigate the forms through which the French public system has been dealing with these three forms of financing since the 90s in ways that replace money from public funds to money coming from financial actors, financial instruments, and the consequences of this turn to the markets. So our methodology consisted on a mixed method approach. We combined quantitative and qualitative information from official public sources. Notably, we built data series using information from the annual reports of French social security agencies and from the French Court of Accounts. We built series in order to assess the amount of revenues raised by the social security and the French public system that came from the financial sector, and also to assess the costs of these strategies. We showed that in all these dimensions, there has been an important move from traditional forms of public funding and towards strategies that are underpinned by financial actors and instruments. So, why is this relevant? I believe that there is a fundamental transition going on in terms of not only how the French public system, but public health systems in general are operating. And this new logic of financing, of where they are getting the money from, is extremely relevant for reasons of social justice and for democracy. I believe looking at the French case is extremely illustrative of how this transition is occurring and what are the potential implications concerning these dimensions I just mentioned. So just to develop the argument a little bit further, when I'm talking about the French public health system and health systems in general, I'm talking about those systems that are managed by the government or by a public entity and that provide healthcare services to the population, to all the population, regardless of each one's ability to pay. So we can say that in general, most advanced countries, apart from the United States, have some sort of comprehensive, universal access to healthcare, of course, at varying degrees of consolidation. And the same goes for several peripheral countries that have also been trying to go in this path of guaranteeing universal healthcare for all the population. And I believe it is not necessary to explain here why is it important to have a public system that is open to all the population in the country, allowing every citizen to get some sort of healthcare, even though they do not have money to individually pay for it. I believe public health systems are the single most important institution to assure that principle that our right to receive healthcare, our right to live really, is dissociated from the money that you have. And after the coronavirus pandemic, I believe it became even more evidence the extent to which it is important to create and to preserve such types of systems and of principles in our societies. So over the past three decades, there has been an increasing debate concerning the financial difficulties of these systems and how this has been undermining their capacity to provide services to the population. So this makes it extremely important to try to see what is going on inside their systems, these systems, especially in terms of financing. And the issue here is that the conventional idea of the challenges that these systems are going through today is much based on the idea that, one, these systems usually raise funds from taxes and social contributions from the government, and two, that they are suffering from austerity policies and thereby receiving less revenues from the government or social security funds that usually come from the sources I just mentioned. Without claiming that austerity policies and the relative decrease in revenues is not something that has been occurring, what I'm arguing is that this is only a part of what is going on in terms of how public health systems are financing themselves today. If we look around, we see that the global economy is going through a process that in economics we call financialization, which denotes the increasing size of financial institutions or financial markets in the economy, but also its increasing influence on governments, on individual behavior, on other sectors of the economy. And when I'm talking about financial players, I'm basically talking about banks, investment funds, investors, and so on. So just for the sake of illustration, if we look at the reports of the largest asset management firms in the world, we see that only a handful of them have a value of assets under management that is larger than the GDP of several countries. So in quite simple terms, these entities have a lot of money and they lend that money to other agents or they invest in other agents, of course, always expecting some sort of monetary return. So considering that one, public health systems are facing financial constraints, and so they need funding, and two, that there is an increasing tendency of several agents in the economy to turn towards financial actors seeking for investments and credit and so on, it is highly unlikely that public health systems will be shielded from this trend. So what we show here is that public systems are also embarking in the process of financialization, resorting to banks, to financial markets, to investors, to seeking to raise the amount of money, increase the amount of money they have to address financial constraints. Most importantly, we show that this closer relation with financial markets, with global finance, is likely to reshape the decisions inside the public system. So basically, as these systems become more dependent on global finance, they have to adapt the way that they work to conform to the standards of financial investors, of creditors, to satisfy the requirements of creditors and investors as well, and of course to compensate them, paying fees, commissions, interest payments, and so on. So we find that this can undermine the principles of solidarity and of democratic participation that are the very own basis of public systems. Just to give a quick example, we show in the paper that with these new financialized strategies, the public system had to create mechanisms to appropriate from taxpayer money or from money of the public health system that was supposed to go to services, to pay for services, reimbursements, and so it could reserve some sort of funds to pay for the creditors and investors. So this, of course, poses serious problems in terms of solidarity and redistribution, as you are channeling public funds to financial markets. There are also problems of volatility because the volume and the costs of available funding for the public health system becomes dependent on the mood of international financial markets. And finally, we should also be aware of transparency problems because there is a long chain of intermediation and financial markets work under highly confidential agreements. Therefore, it becomes very difficult to understand from where exactly this money is coming from, as well as to where is the final destination of the payments made by the government, by the social security system, which of course poses serious problems for social accountability, democracy, and so on. So next, during our research, it became quite clear that these broader economic and social costs of these strategies, such as those that I just mentioned, they are not usually taken into account into the calculations to assess whether these strategies are good or not. We only know about the immediate costs of these strategies, and even in that case, they are not adequately reported to the society. So this means that the turn to the markets is being presented as a technical choice, a positive solution to address the financial difficulties of public health systems, when in fact, if we took into account the broader set of economic and social costs these strategies may bring, the results probably would be quite different. So this means that it is important to continue investigating how public systems are becoming dependent on financial markets to try to incorporate these broader economic and social impacts into account. And also, it is important to try to uh, compare these strategies with traditional forms of financing, considering that these broader economic and social costs are taken into account. I believe this discussion is fundamental to also reflect on what would be the alternatives, what could be the alternatives to fund public health systems in ways that could be more in line with principles of equity, redistribution, and so on. So I guess I could end here. And I invite anyone to read the paper if they are interested and want to know a little bit more on the topic. Thank you.